You are listening to Realign Your Life Podcast, where I discuss with you strategies on how to realign your life and move towards the direction you always want to. I am Vivian, the host of this podcast, and every week I will bring value on how to improve and realign your life either through a guest or my thoughts. I can't wait to share what we have this week. It's time to realign your life. Well, hello there. Welcome back to Realign Your Life Podcast. I am so excited and so honored to have you here with me today for this episode. This is Vivian, the host of the show. And boy, oh boy, I do keep my promises. I told you that I would get Dr. Whitaker-Brown to come back and share again with us all about the importance of our mental health checkup. Now, guys, you know this is all about self-care and realignment. So it's very important to make sure that our mental health is indeed in order. Because a lot of what we've talked about on this podcast is all about mindfulness, all about self-actualization. So we have our guest, Dr. Whitaker-Brown, clinical professor and dual certified family and psychiatric mental health nurse, here with us today. So welcome back, Dr. Whitaker-Brown. Thank you for coming back.
Absolutely. Thank you for inviting me back. I'm glad to be here in this space.
Yes. For those of you that did not hear the previous episode that Dr. Whitaker-Brown was on, okay, you really missed out. And I would encourage you to go back and make sure that you listen to that episode because it was absolutely packed with a lot of powerful information that you can use. And of course, she is available for you also. But let me just bring you up to date on who we have here speaking with us. She served as the second Doctor of Nursing Practice program and coordinator from 2014 to 2018. And under her leadership at the University of North Carolina at Charlotte, the program thrived, leading to a historic moment when she became the very first, not the second, the first DMP program coordinator to graduate the first postmaster's Doctor of Nursing Practice students from the School of Nursing. I am so proud of her because she's one of my sisters and I'm a nurse too. So that makes me very proud of her. But currently she continues to be very, very active and a very influential member of our community while engaging in scholarship and service. And some of her community service relationships include well-known agencies in healthcare, such as a member of the Caring Nurse Family Partnership, clinical director of Harmony Health, and she is a community partner with AmeriHealth Caritas and a key collaborator with the Mind Heart Institute and Wellness Center, which you will hear a whole lot more about momentarily. I do want you to know that she has been instrumental in translating research into practice, and her clinical focus has primarily centered on improving the quality of life for heart failure patients, and identifying ways to assist these patients in coping with depression and anxiety. Her dedication to this field was recognized in 2021 when she was selected by the Point of Care Network as America's, listen people, America's top nurse practitioner in cardiology, health failure, underscoring her expertise and leadership in this critical area of healthcare. So welcome back, Dr. Whitaker-Brown.
Absolutely. Thank you so much. Thank you for having me.
So share with us how you really got involved in this discipline of nursing, what led you to it, because there are, oh my goodness, scores and scores of practice fields that you could have gotten involved in nursing. So why did you choose this particular area?
Absolutely. That's a really good question. As you were mentioning in the bio, I've been recognized as America's top NP for heart failure in 2021 by the Point of Care Network. And actually being a heart failure nurse practitioner is actually what led me to being in front of you today as a dual certified family and psychiatric nurse practitioner. I worked in heart failure as a nurse practitioner for about 10 years. And during my time working with my patients, I noticed so much of the issues that they were having, in addition to their heart, were mental. So a lot of my patients came in with depression and anxiety. And a lot of the times it was untreated depression, untreated anxiety. And I felt that there was a gap or something missing in my treatment. So as a nurse, you know how we feel like, we want to take care of the whole patient, right? We talk about holistic nursing and treating everyone from head to the toe. So when I was in a more specific area, I felt like I was missing something in that mental health arena. And, they just constantly came in and still had depression, anxiety. I'm like, I'm treating their heart, but I still need to treat their psyche. And so that is kind of one of the things that kind of transitioned me into looking into how I could treat my patient. So I had already had a doctoral degree, but I ended up going back and getting another master's degree as a nurse practitioner, psychiatric nurse practitioner, because I wanted to add that additional layer to my treatment of my heart failure patients. I wanted to be able to make sure I knew what I needed to do for them to help not only treat their heart, but treat their mental health as well. And so in 2020, I graduated from the University of North Carolina at Chapel Hill with my psychiatric nurse practitioner degree. Wow. And those were the things that kind of got me to the point where we are here today, because I wanted to make sure I could not only treat their heart, but their mental health. And of course, as things kind of transpired, the pandemic came and a lot of things changed in healthcare. And it was an interesting time where things were starting to go virtual, right? So we were having a lot more virtual appointments, and opportunities came my way where then I was able to transition into working with my heart failure patients all the time, and then working with more of my mental health patients. So I recently opened the Mind Heart Institute and Wellness Center, and I treat patients ages 18 and up for mental health issues as far as like depression, anxiety, OCD, work-related stress, ADHD. So those are some of the things, bipolar, those are some of the things that I assess and treat in the clinic.
Oh, that's absolutely wonderful. And that's great information, because many of us are familiar with our physical checkups, but mental health checkups, they are less frequently discussed at all. So can you explain to us, and you've shared with us, how your heart patients came in with all of this mental stuff going on, and that was being completely ignored. So can you just explain to us, to share it with us, why mental health checkups are just as important in our overall well-being?
Yes, exactly. So it's so important that now a lot of things have changed, and there has been more recognition in a lot of practices, such as where I work with heart failure, primary care doctors. A lot of these places now, since that time where I initially started, they're implementing something called a PHQ-9. And what that is a brief assessment where the patient can take these questions, or the patient has this questionnaire. They might take it by written, or the provider, or maybe the medical staff person, maybe a medical assistant or the nurse will ask these questions. And then this helps to make sure that if finds out if the patient's maybe depressed, then they can talk further into what can we do to help get you the resources that you need to manage this type of depression, or manage this depression that is showing up on the screening tool. So now in healthcare, one of the things I like is a lot of places are now implementing these things, such as these screening tools. One of the things I do in my practice when I see patients, I do a PHQ-9, as I mentioned. So that assesses that's a depression screening. And then I also do a GAD-7. So that's a generalized anxiety assessment as well. So those are some key indicators, really good screening tools that you can do or implement to assess and see if that patient needs maybe further assistance, further information, or further checkup. And so I think having those screening tools are so helpful. And I think also it's so important for patients to know, or people to know, or clients out there, our listeners to know that you don't have to be in a crisis situation to seek help for mental health. Okay. So you don't have to be in a crisis situation to seek help. And I think that's so important that people need to understand. And it's hard. You know, I've been on the other side of the phone call where patients or potential clients or people who are interested has said, you know, this is my first time identifying that I need help, or this is the first time I reached out to someone. And I take it, I feel so proud and happy. And I feel like this is, a really good thing that those people entrust me to, start the conversation. And it only takes you starting the conversation. And I think and that's what we're doing here today. That's what we're doing on your podcast, right? We're starting the conversation, normalizing it, making sure that people know it's okay, that they can reach out for help, to others, because it's so important.
Well, I think it's wonderful, too, that you're saying, if I hear correctly, that mental health checkup is becoming integrated with your regular checkups, and that if your physician or your primary care physician is not doing that, that's a question that a patient can pose to them about that. I know that my primary care, they asked me 100,000 questions about my mental health. At first, I was kind of hesitant to do that because I didn't want it recorded. I'm like, you don't think I'm depressed? I don't think I'm depressed, but we may be depressed and not know it. And we're being made self-aware. Is that part of the whole thing also? Because sometimes we may not just be that self-aware.
Yes. I'm glad you said that. Those are some key words: self-awareness. And being self-aware can come in all types of forms. And in the form we're talking about is when you're following up with your primary care doctor, or any avenue you might be in. It's okay to do a self check-in with yourself. Like, am I feeling okay? Am I feeling normal? Is this normal for me? What's going on in my day, or what has happened to make me feel this way? Start kind of, as we mentioned on our previous podcast, start peeling back those layers to find out, why am I feeling this way? And that's a part of that awareness. That's so, so important to identify those feelings of awareness and kind of get to the root of the problem. And then that's where the mental health professionals come into place, where they can help you get down to that initial issue and help identify it to help make you feel better, because it's all about mental health and wellness. And we want to want people to thrive and feel good about themselves. And the only way to do it is just to identify it and normalize it, as we mentioned earlier. It's okay to seek help, and we want you to be self-aware. So yes. Exactly. And then, like you mentioned before, talk to your doctor and inquire and ask them, are they asking you questions? Because there are certain tools that the doctor can implement. Now, a lot of the doctors might do like a 2-question assessment, and that will help them do a really quick screening, because we know when you go to the doctor's office, they don't have a lot of time. So they might not be able to ask a whole plethora of questions, but they can do 2 quick questions that can help them identify if you need to be referred for further assistance, further help.
One of the things that you mentioned in the podcast, so you guys got to go back and listen.
Gotta go.
And we've talked about this before, is having a tribe of those people around you that know or see that your behaviors are becoming a little bit different. And having those people around you that are open and honest enough with you to let you know, hey, girl, something's not quite right here. What's going on with you? And then that will entice you maybe to seek some assistance. So would you say that there are some specific signs or trends in our society today for the growing importance of mental health checkups? So what do you believe that the future holds for the integration of mental health assessments into our regular health care?
You know, this is a hot button topic, and it's happening right now with a lot of healthcare facilities integrating mental health into their primary care clinics. As you mentioned before, I am also a clinical professor in the School of Nursing. So I teach across the curriculum. I teach undergraduates through our doctoral program. Part of my role in one of the classes that I teach is going out to clinics to assess my students who are shadowing or actually working with family practice doctors, family practice nurse practitioners. In several of the facilities that I have entered in to see my students, these facilities are now holding or hosting or holding space for that mental health clinician. So it is an integrated, like you mentioned, it's an integrated part of their everyday practice. So the patient comes in, they see their primary care doctor, and then if the primary care doctor feels like they need to have some further intervention with the mental health specialist, they can go ahead and refer them same day. The mental health specialist can come in, briefly do like a quick chat with the patient, and then get them scheduled for a more thorough examination, right? An assessment. And so I've seen that trend a lot around the area, and I'm really excited about it because I think it's just going to improve primary care, and it's just going to improve the overall mental health and well-being of everyone. So that's so important, so key.
Well, one of the things that I talk a lot about and share a lot on this podcast is that we have to give grace to ourselves, and we have to be kind to ourselves. And I know that this year's World Mental Health Day, their emphasis was kindness in the community. So can you talk about or speak about a little bit about being kind to ourselves? What are some of the things that our listening audience can put into practice, even if they are not having an audience with a mental health care provider?
Absolutely. So it's so important. Audience can take these small steps. And I think you might have mentioned these in some prior podcasts with meditation, mindfulness practices. For example, I kind of hit on earlier in the previous podcast a little bit about deep breathing. There are different types of methods people use. There's like a 4x4 method or a box method. So deep breathing is so good. So a couple things is, you can just sit still, ground yourself by placing each foot on the ground, placing your hands in your lap and sitting straight up and just inhaling and taking a big, deep breath in and then holding that breath for like 4 seconds. And then you just sit there and like blow all of that out. And then just repeat that for maybe 2 more times. And that's a good way to initially kind of get started. I see you doing it. That's right. You're doing it. That you got it. Don't forget to blow the breath out. But yes, that is what you do. So you start by grounding yourself and taking those deep breaths. And I'll do one now. Like, and then you can just start to feel your body kind of relax.
Yeah.
And that just took less than 5 seconds for us to kind of recenter ourselves. And it's a good way to, like I said, get grounded. So deep breath, physical activity and fitness. So that's important too, right? So trying to get some physical activity every day. If you can't do a long block of 30 minutes, break it down. Every few hours, take about 5 minutes. Or if you have 10, take 10 minutes. Go outside, do some walking around the house, do some walking in the house. If you have some type of equipment, a stationary bike or a rowing machine, whatever you have, take some time to do some cardio and give your heart muscle some exercise. Let that heart muscle work some. Because our body thrives on movement, and it just overall helps with the circulation and overall helps with our brain health as well. So mental health is brain health, and everything works together. Everything is so important.
Well, you started that out with letting us know how important that is. And I had never thought of that the heart patients are coming in with, in depression and anxiety. And if we're not taking care of ourselves, that is where we're going to wind up. That's where we're going to end up. So you see where we can see where that connection is: heart, mind, and body.
Right.
It connects. It all connects. So what are some things that our listening audience, what are maybe 3 or 4 things that you would say to this listening audience that they could actually put in practice themselves?
Yeah, absolutely. So first thing, I always feel like, people are always talking about writing things down, but it's so important to journal your thoughts and get emotions out. So I first say, start off getting yourself a journal. You don't have to have a journal that you buy. You can get some paper, just loose leaf paper, or get a binder, make your own journal, and just start writing down things, writing out your thoughts, and put a date on it. So when you go back, you can reflect on what was going on that particular day. Put the timestamp on it too, that particular day and that particular time. So start off doing some journaling. I think that's the number one thing. Next, you mentioned your tribe. Find your tribe. Find those people who you can entrust talking to and getting some feedback from them. So find your tribe. So you can journal, you find your tribe. 3, incorporate that physical activity and fitness. Don't forget about that. It's so important. I'm going to give you 5. 4, make sure you eat those fruits and vegetables. The thing I love about being dual certified as a family nurse practitioner and a psychiatric mental health nurse practitioner, one who has worked also with a lot of cardiac patients, the Mediterranean diet, we've talked about that a lot, and that can just help just everyone in general. It doesn't just have to be specific for a heart failure patient. That can be specific for everyone. And that's a lot of, you can look that up. It's like fish and some vegetables and all of those things. It's not a lot of grains on there, but look up the Mediterranean diet because that's very helpful too. So you have that. And then finally, reach out to others, reach out to your primary care doctor, reach out to therapists, reach out to people like me, psychiatric nurse practitioners who can move you forward and help you advance your mental health and wellness. And know that it's no longer a stigma. It's okay. it's okay to seek help, and it's okay to talk to others about what's going on. It's so much going on in everyone's day-to-day life. So we definitely need to make sure we have a sounding board. We have our tribe. We follow up with our practitioners, our doctors, our nurse practitioners. We journal. And then don't forget to also do your deep breathing and grounding yourself, and take time out to do that exercise and keep that muscle going, that heart muscle, so it can keep that brain muscle moving too.
This has been so informative and so very well put. Journaling, I had not thought about that, but I have journaled for a long time. But I love the idea of you saying, make sure you date it and time stamp it, because you can go back and see, this is how I was feeling that morning. And then maybe that evening, or you've been out there in that workplace. And that was another thing that I wanted to mention. You talked about at the top about a discussion about work stress. Yes. And that is rampant for a lot of people, and especially post-COVID. Post-COVID, we've talked a lot more about mental health and mental fitness than I've heard mental health talked about in eons. So with that, I think that there are some things that we really need to zero in, and especially not only us that are listening to this podcast, but those that our young people, because I know that the suicide rate is going up now. Domestic abuse, it was at an all-time high, and it's all because people have not had an avenue to address those mental health needs. So in addition to sharing with our audience how they can reach you, would you also share with them maybe some of the associations that you are associated with that provide additional help that does not fall under your practice?
Absolutely. Absolutely. So first, I'll start off with my phone number. Mind Heart Institute and Wellness Center, 704-946-5918. So that's 704-946-5918. I can also be found online. My website is www.mindheartiwc.com. So that's mindheartiwc.com. My email address is info@mindheart.iwc. And I can also be found on Facebook, Instagram, TikTok, all of those social media sites. And then a couple things I wanted to share about other avenues. I always like to end.
So Dr. Whitaker-Hart, before you share that, does our listening audience need to have a referral in order to see you? And is your handle the same on social media?
Oh, yeah, absolutely. So, yes, the audience does not have to have a referral to see me. So that's good. And the handle for Facebook is just Mind Heart. This is the entire name of the institution. So mindheartiwc.com. And then Instagram is the same. And I'm also on Facebook as well as Charlene Whitaker-Brown. Sorry, not Facebook, but Instagram is Charlene Whitaker-Brown. And so you ask other ways or other things as far as like referral. No, patients don't have to have a referral. You can contact me directly. I do accept insurances. So I accept Cigna, Aetna, United Healthcare, Blue Cross Blue Shield, and Medicare. And then if you don't have insurance, you can call me and I can let you know what the options are for the cash-based price if you have to pay out of pocket. So those are some great options. So it is, those are ways you can reach me. and get in contact with me. So that's very helpful.
Super.
And then go ahead. And then you asked about, I have some like crisis lines that we can utilize. And I always like to share that with people too. And these are some helplines. So, and I'm going to read it verbatim because I never want to mess it up. But it says, if you're experiencing a life-threatening emergency, feeling in deep distress, or have thoughts of hurting yourselves or hurting others, go to, of course, your nearest emergency room. Or you can call 988 for emergency services. So this crisis and suicide helpline is 988. Okay. So there's also a crisis text line. And so the text, you text to 741-741. So that's 741-741. And that's a free 24-hour, 7-day-a-week confidential text message for text messaging service for people in crisis. So 741-741, confidential service for people in crisis. And then, of course, last but not least, your National Suicide Prevention Line. You can call or chat at 800-274-8255. That's 800-274-8255. And then if you speak Spanish, the number for Spanish for that same line is 888-628-9454. And that's for, if you speak Spanish, it's 888-628-9454. So these are just some really good resources if you should find yourself in some type of crisis.
Well, thank you so much for sharing all of this wonderful information. And so listeners out there, I pray that you would take all of this to heart, because as I often mention, is that God says we are to love him with all of our heart, our soul, and our minds. So we want to keep our minds healthy. We want to keep our heart healthy. We want to live a whole and holistic life. And I am so excited and I am so appreciative. And I thank you so much, Dr. Whitaker-Brown, for being here and sharing with so many people out there that this will benefit. And those of you that are listening, if this has helped you or benefited you at all, I thank God for that. And if it has, and you know someone out there that this could help, please make sure that you share this information. And just remember that you need to journal, and you need to date that journal and time stamp it too. You need to make sure that you got a positive, supportive tribe in your midst. You need to get out there and exercise. Sorry, you got to exercise. You got to move. Body is made for movement. Make sure that you're eating right. And Dr. Whitaker-Brown advocated and encouraged you to try that Mediterranean diet. And we know it won't happen overnight, but you can just ease into it. This, remember, this is a journey. We're on this together. It doesn't happen overnight, but each little step that you take is going to be helpful. And I think the last thing that she said was to reach out to others, to your mental health provider and your primary care physicians. They're all there to help support you and to make sure that you are living that healthy life. Is there anything else that you would like to leave with our audience today?
You know what? I just want to say thank you for having this platform, for learning so much. You have so much great knowledge here. And so thank you just for inviting me to be a part of the platform. I really appreciate it.
You're absolutely welcome. And thank you for being here. And I did not mention this in her bio, but she does an awful lot of work with Alzheimer's also. And that is another disease process that not only affects patient, but it also affects family. So I know that there are probably some caregivers out there that are listening that would love to know more about Alzheimer's and how to really navigate that realignment of your life, both for that patient and also for you as a caregiver. So we will have her back in the future to talk to us about that particular subject. So I hope you have enjoyed this today, listeners. Thank you for your undivided support for realigning your life. And as you realign your life, I wish you much, much peace. Until next time. I hope you enjoyed this episode. The best gift that you could give me is to share this podcast with family and friends. And don't forget to review it. That way, this podcast will grow organically. If you need to reach out to me, please check out my Facebook page, DM me there, or you can email me at godskow@gmail.com. We have upcoming Bible studies that we would love for you to join us in, or if there is a guest or someone that you would like to see me interview on this podcast, please let me know. We are here to work together to realign our lives. Until the next episode, take care, and I look forward to sharing more and more with you as we realign our lives. Peace until next week.